One of the most common problems that I see in the office involves arthritis in the thumb. One of the reasons that is so common is because anytime you use your hand, you're using your thumb. And the specific biomechanics of the thumb are that if you pinch a pound out here at the tip, it's 12 pounds of pressure at the base of the thumb. So you have multiple joints in the thumb. You have the joint here, here, and down here. This joint is what's called the carpometacarpal joint, and it's really the joint that sees the most stress. There are basically 3 treatment options for the management of that arthritis. The first is a brace, and this is a special brace that the therapist makes for you. We'll usually send someone to the hand therapist and they'll make a custom brace, and I'll have the patient wear that for about 4 weeks and come back and see me. If it's not any better, then we'll frequently try a cortisone injection, which about 80% of people find is effective. About 70% of people will feel better just from wearing the brace. So only 20 to 30% need the injection. The injection works about 80% of the time. The last option for treatment is surgical treatment, and that's what we call a CMC arthroplasty. The procedure itself involves a small incision directly over top of the joint, and the arthritis, which is breakdown of the cartilage between 2 bones, is occurring between this bone, which we call your metacarpal, and the little small wrist bone called your trapezium. So that cartilage surface is worn out. Through this small incision, which is about 1 inch long, we go down and actually remove the trapezium bone to remove that bone rubbing on bone. And then we'll make a small incision in your forearm, and we'll actually use one of your forearm tendons that you can functionally do without to fill that space. It's not any more complicated than taking that tendon and rolling it up in a big ball and putting it in the hole. And it serves as a spacer, a soft spacer, the sort of Oreo, the middle of the Oreo there between the bones, so that you're not getting any bone rubbing on bone. Once you are out of your 6-week splinting period, your activities are really just based on comfort. So most people will continue to use the splint for a period of weeks as they're starting into their therapy program, but really they're allowed to do whatever feels comfortable. A lot of people have this concept that if it's arthritis, you can't do anything about it. And that is absolutely not true, particularly for this thumb joint. So we have several options that really can significantly help someone with overall hand function. If your thumb is working better, your whole hand is going to work better.